Здравейте! Welcome to the model Health Aspects and Urban Green System. Have you ever heard about the lungs of the city? Evidences from landscape and urban park history prove the strong link between green space, public health, and bodily metaphor since the 19th century era of the city, when elite spaces across Europe and North America were opened to public access and new areas were developed as parks for the people. Although the axioms of recreation, industrial modernity, and public health then operated in specific urban contexts, park planners embraced a holistic vision articulated via bodily metaphors that incorporated both social and environmental aspects. Placing the green system elements within a functional urban metabolism today may help to theorize a new approach to the livable city that combines scientific judgment of natural value with the presence of a consistent historical narrative that seems imperative in a 21st century world, in which 86% of humans will be city dwellers by year 2050. Urban green system of 21st century cities is composed of diverse, varying in size, vegetation cover, and rich in species, public and private green spaces, characterized with different environmental quality and proximity to housing areas, public transport, facilities, and services. The urban greenery has been consistently read through the lenses of health, biological synthesis, and social environmental well-being. Urban green space supports the ecological integrity of cities by providing ecosystem services and protects public health of urban populations. Green infrastructure can include features such as rain gardens, bioslaves, planter boxes and planting stripes, urban tree canopies, natural areas such as parks and wetlands, green roofs and green facades and permeable pavement, as well as techniques to redirect, capture, and store rainwater for irrigation and other uses. The green space may filter air, attenuate noise, infiltrate stormwater, replenish groundwater, and moreover, it can provide food. The green cover and urban forests can moderate temperatures by providing shade and cooling the area, thus contributing to mitigation of the heat island effect and the reduction of the risk of heat-related illnesses for city dwellers. Trees, shrubs, and greenery have the ability to absorb air pollutants and trap airborne particulates on their leaves, reduce surface and air temperatures through shading and evapotranspiration, and provide a physical barrier to traffic and street noise pollution. Green infrastructure increases exposure to the natural environment, reduces exposure to harmful substances and conditions, provides opportunity for recreation and physical activities, improves safety, promotes community identity and a sense of well-being, and provides economic benefits at both the community and household level. All these benefits described so far are known to directly or indirectly benefit public health. Therefore, green infrastructure elements combat processes as exposure to air pollutants and particulates that can worsen asthma conditions and cause respiratory diseases, cardiovascular disease, stroke, cancer, and even premature death. Extreme heat events can lead to heat-related illnesses and fatalities, while noise pollution is linked to hearing and cognitive impairment, hypertension, stress, and sleep disturbances. These are all health impacts that are especially harmful for children, the elderly, and those with pre-existing health conditions. Green infrastructure installments also provide natural habitat for birds and wildlife and increase green space, which leads to reduced anxiety and stress and improved mental health, cognitive function, healing and recovery, and overall health and well-being. Greenery as a public good can also have positive impacts on social determinants of health, such as recreation and physical activity, social capital, and crime prevention. From the health perspective, urban green spaces are spaces that allow for health-promoting activities such as physical activity or rest and relaxation to take place. The natural habitat and green space provided by green infrastructure creates places for recreation and improves social capital. Attractive, accessible green space can improve community identity and sense of place, improve aesthetics, and provide a place for gathering and social interaction. Improved social capital has been linked to reduced stress and improvements in mental health and overall health and well-being. Green space and its improved aesthetics also have the potential to reduce crime and violence in a community. Physical activity has been proved to reduce stress and risk of obesity, cardiovascular diseases, hypertension, diabetes, stroke, and certain kinds of cancer, and leads to improvements in mental health and overall health and well-being. Numerous studies in the past 2 decades have reported the interrelation between contact with green space and health benefits both at the individual and population level. The 3 main mechanisms for these benefits include provision of opportunities for physical activity, recovery from stress and extreme tiredness, and facilitation of social contact. Urban green space is therefore particularly important in urban areas when access to the open countryside is limited and vice versa, as revealed during the COVID-19 episode. When there are limitations on use of space, suburban parks and rural areas at close proximities to cities are used for recreation as extensions of the green system. Indeed, accessibility of green spaces influences not just the likelihood of physical activity being undertaken, but also its frequency and therefore may facilitate active lifestyles in the urban setting. For the past decades, researchers, policymakers, and practitioners looking at the intersections of planning, design, and public health have focused more on chronic disease, hazards, and disasters, and the vulnerable, and less on infectious diseases. The current pandemic brings the question of open public space design for infectious diseases back to the forefront and raises important questions for future research and practice. The degree to which the environmental, social, economic, and public health benefits of green infrastructure are realized is dependent on a number of factors in the course of the different stages of urban green system management and at different levels: city, district, neighborhood, and community. Green system life cycle comprises evaluation, interventions and rehabilitation, planning and design, implementation, and day-to-day management and monitoring. Along with the viability of functions of green system elements, important factors and features that contribute to the health benefits of the green system are proximity, connectivity, size, equal distribution of green space and facilities, perceived safety and good upkeep, and access. When evaluating the identified and targeted pathways and uses, it is essential to study the use of the green space and the satisfaction among users. It is also important to collect data from people who are not using the green space and to understand what the related reasons and potential barriers are. Some studies prove that quality of the space is more important than quantity. On likelihood to impact on psychological distress, quality is described as the presence of walking paths, shade, water features, irrigated lawns, bird life, lighting, sporting facilities, playgrounds, type of roads in the vicinity, and presence of water nearby. These qualities bring diverse associations to different types of user groups which occupy public open spaces. For example, some may find water features calming and attractive, while parents of young children may see them as safety hazards. In addition to the qualities and characteristics of the green areas, social factors also play an important role in determining their accessibility and use. Where feelings of community cohesion are absent, individuals may be less likely to use parks. Such local socio-cultural aspects of the neighborhoods may adversely contribute to inequalities in health. Over the past 3 decades, the uneven accessibility of urban green space was recognized as an environmental justice issue strongly connected to public health. The reasons why green space is differently and unequally distributed within the urban landscape are various, might be rooted in the philosophy of park design, history of land development, the evolving ideas about leisure and recreation, histories of class and ethno-racial inequality, and models of state interventions in public space. If there is a need to understand more complex relationships such as physical activity and displacement from one side to another, a stronger commitment of time and budget is required. Also, it is important to be aware that health outcomes are affected by many determinants, and therefore, green space interventions may benefit health and well-being, but not automatically lead to significant improvement of health status indicators. Therefore, evaluation efforts should be realistic and proportional to the scale of the intervention, be practical and fit for purpose when designing the intervention's evaluation. Different levels and natures of interventions can either regenerate abandoned area, reconstruct existing green area, improve urban green space, integrate development of green and blue infrastructure into transport project, or simply apply the urban acupuncture approach and achieve positive health, social, and environmental outcomes for all population groups, and particularly for lower socio-economic status groups. Traditionally, public authorities are the main stakeholder responsible for green system management, though recent practice from the last 30 years prove that cross-sectoral collaboration between local authorities and community groups and private actors can help the interventions to deliver on multiple outcomes. The implementation of the dual approach that couples physical improvements to the urban environment with the social engagement and participation is applied in many European cities with the active support of the European Union institutions through the urban agenda for the European Union, and especially the priority theme, sustainable use of land and nature-based solutions. Community engagement and the delivery of interventions that serve the need of the community ensure that urban investment in green system will deliver the strongest benefit over a long period. Urban green space has to be considered as part of the comprehensive urban planning process and the wider green infrastructure network design. When approaching the planning of urban green space system, experts try to integrate the objectives of green space planning with a long-term flexible perspective. make use of the urban local planning context and frameworks, and consider green space projects as a public health and social investment. Diverse tools, standards, and expert recommendations for planning and design of urban green at different levels should be well integrated and embedded in local planning frameworks and master plans. Planning should provide diverse urban green space types, responding to diverse demands, and at the same time provide resilience and reduce the risk of crime, related injury and stress, as well as easy maintenance. Leading design strategy is to empower communities and put green space close to people by co-creating simple design features to improve the comfort of urban green space use. Design for healthy urban green space is related to the maintenance needs of the urban green space and the real capacity of the end users to take care. Design of urban green space should provide multiple benefits and constitute a necessary feature of healthy settlements design. Nature-based solutions are an important element of green system planning and design, as they bring more and more diverse nature and natural features and processes into cities, landscape, and seascapes through locally adapted, resource-efficient, and systematic interventions. In addition to the benefits to biodiversity and support to delivery of a range of ecosystem services, nature-based solutions can, and indeed often do, require new processes for design and implementation that are by their very character more inclusive, and that they are able to provide outcomes that are transformative for nature, people, and place. Day-to-day management of plants is essential for the attractiveness and livability of open public space. Main maintenance tasks in urban green space may include trimming, irrigation, tree cutting, removal of plant waste after every time of the trimming or cutting, fertilization, and insect treatment. The last two may have serious health implications on human health and recently have been even denied by some communities across Europe. It is essential that users of urban green space perceive it as safe, clean, and in a good condition. Poor management and maintenance send signals that nobody takes care of the area and thus can encourage antisocial behavior. Maintenance measures that increase the perception of comfort and safety and prevent antisocial behavior are, for example, managing vegetation so that it doesn't block the line of sight on pathways, ensuring that trash bins are provided and emptied regularly, combating vandalism persistently and fixing vandalism as quick as possible, and considering crime prevention through environmental design principles. The use of urban green space and the related benefits need to be evaluated to inform future planning and to ensure that existing green space are reviewed and adapted to meet the community's needs and minimum health and safety standards. For this purpose, quantitative data and qualitative data provide different types of information on the impact of the intervention and are equally important. Although impact data would be often preferred by policymakers and funders, observational studies and self-reported data can still be useful to document the impact of urban green space interventions projects. As the data needs serious amount of funds, different types of collaboration could support their collection and fill capacity gaps. Collaboration with research institutions and universities that can provide improved impact assessment surveys, guide and the involvement of citizens and residents in documenting the impact of local interventions. Potential challenges and conflicts to be addressed during the green system life cycle are the conflict between users and competition for space, community dissatisfaction with urban green space features or ecosystem services, and degradation of urban green space due to overuse. Lighting and well-equipped facilities for socializing may raise safety issues, induce antisocial behavior and vandalism, and provoke fear of crime. Potential increase of health risks related to overcrowded urban green spaces may arise due to increased interest after successful completion of a project for rehabilitation of open public space. Gentrification and displacement of residents with low socioeconomic status due to increase of property values and cost of living in a community is possible when the green infrastructure is at the focus of urban regeneration. If we have to summarize the essential activities during urban green system life cycle management in relation to healthy urban environment are to engage into the local communities, provided access of green space and identify local needs. To build, modify, and adequately maintain urban green spaces, providing the required functions and facilities. To promote the use of urban green space to all local residents, and to review effects of green spaces on local environment, lifestyle, health, social equity, and well-being. Thank you for attending this module. Do novi srešti!